When I look into the mirror, it's your grace I see.
Hello everybody, my name is Nonsindiso Mhlongo. I'm a medical student at Ukzn. If you're new here, welcome to my YouTube channel. If you're a subscriber, thank you so much for coming back. I'm back again with another video. I know guys, it's been too long. I think my last video was in June. I think it was in June. I am so sorry guys for the delay. Fourth year has had me up to here. But I'll be explaining what happened, and I'll be explaining all those things in a different video. This video is basically aimed at explaining just to everyone the layout of medical school in Ukzn. So I've always wanted to do this type of video because that is like the source, if I can say the source, but the main reason why I opened up a YouTube channel, because I remember in grade 12 when I was looking for these type of videos, I really wanted to know about all the medical schools and to know what is going to happen, what I should expect, but yeah, here I am today. I'm here to do that type of video. Stay tuned. So yeah, I'm going to be talking about the layout of medical school and the different accommodations that we have in Ukzn medical school. So firstly, just as an introduction, Ukzn, as we all know, is University of KwaZulu-Natal. It's based in KwaZulu-Natal in Durban, near Umbilo. And yeah, so it's basically 6 years, so as in other universities. So the first 3 years, it's called, okay, I don't know if I remember the whole name, but it's LMMS. I think it's laboratory, medicine, medical science, don't, but it's the first 3 years. We have the first 3 years and then the last 3 years. Basically, the first 3 years, it's all like mainly your theory, your physiology, your everything theory, but we do get like a sort of clinical component. Yeah, but that's just like the outline of the video. And then the last 3 years is your clinical years. That's basically where you do your rotations in the different hospitals and stuff. So yeah, so it's different for like all of us. I went to medical school I did first year in 2020. So like March, that's when we had COVID. So my first year would be different from the first year of someone who did first year like earlier than me, and someone who did first year after me. So basically what we were doing there is just like the introduction to everything. That's where you still like do your physics, we do chemistry, we do like becoming a professional. We do like a lot of modules in first year, biochemistry, and yeah, we did languages. We did isiZulu. You have to do isiZulu, and we did like English, like medical writing. Like they teach you how to write stuff like in university, all those type of things. So first year was basically that for me. But now I do see first years going to like the skills lab and stuff. I didn't know that we were supposed to do that, but I guess it was because of COVID. But I think first years do OSCEs. So OSCEs are like they're sort of like directly observed like assessments where you get like a patient, but that patient's like not like a real patient, it's a simulated patient, and you get to do your history. So history is like when you ask someone why they are there, and it's a lot more complex than that, but yeah. And in second year, second year was the hardest for me, because the whole dynamics changed. We were starting to get back into lectures. We went back to like the school, the races and stuff. So we started like doing hectic stuff. We did the different systems. I know different universities do things differently, and yeah, but I'm just gonna explain what I know from my university. So that is what happened in second year. We started off with the respiratory, the general system, the respiratory system. We do the cardiovascular system, the what you call this, but the kidney system, nephro, and we did GIT. Did we do GIT in second year? Yes, and we did the reproduction system. So that we just did everything based on that, the physiology, the anatomical pathology, the pharmacology, everything based on that system. And then in third year we did neuro, so we continued with the system. We did neuro, we did infections. Okay, that's not systems, but like we did like a theme. They're called themes. So we had like 5 themes in second year, and third year I think we also had 5, if not 6. So yeah, we started with CNS, and in third, I must say my third year was better than second year, but third year was longer. So yeah, we did the infections theme, infections prevention and control. What else did we do? But like, if you get it, you get it, you know. And then in third year we were introduced to clinical methods, which was basically like clinic rotations. So we rotated in different hospitals, and then they were just teaching us the basics and like knowing how to examine patients and stuff, you know. And there was like, okay, we started that in like March and April. Oh, we started in April, and then at the end, at the end of the year we had like a test, but we were supposed to have like an OSCE of 10 stations, but because like it was the first time it was happening, it was supposed to happen in since COVID, we weren't able to do it. But other years after us, like this year, they are doing it, the 10 station OSCE. Yeah, so so then fourth year, currently I'm doing fourth year, so you so fourth year we just okay, I'm gonna do like a detailed video based on fourth year, or I'm going to like do it at the end where like I reflect on my fourth year. Yeah, I think I'm gonna do that. So fourth year is basically like everything is clinical now, like everything is serious stuff right now. So like we divided into different groups in our class, and there's like there's 6 blocks, so there's different blocks that we each rotate in based on our groups. So firstly, I'm just gonna mention the blocks in order of how I did them. So I started with family medicine, then I did trauma, then I did internal medicine. So each block is 6 weeks. So you have like basically you have like 5 weeks, and then the last week, that's when you have your test and exams and stuff. So each test and exam, it's not like basic, you have a test and exam, it's different for each block. So that is what I'm gonna be talking about in the last like when I'm talking about my fourth year. So we do that. Okay, so I mentioned family medicine, trauma. Trauma is like more like emergency medicine, and then I did like internal medicine. Then it was obs and gynae. So it's called obs and gynae, but actually in fourth year you do gynae, and then in fifth year you do obs. So we did gynae, and my last block was pediatrics. So that's like everything children. Each block is 6 weeks except for internal medicine, which was 12 weeks. Yeah, so then I also have fifth year. I think there's also like 6 blocks. I'm not sure what blocks you have in 6th year, but I know that some blocks are like repeated, and then you get new blocks like psych and surgery. Yeah, not sure though. And then and ops, and then ops, and then in 6th year there's a repeat of some blocks like internal medicine and pediatrics and psych and obs and gynae. And then in 6th year obs and gynae is like it's combined, so you have like 3 weeks and 3 weeks for each thing. Yeah, I think I've mentioned everything. So that's basically like the outline of medical school in Ukzn. I know other universities are different, and I really love to know how like they do it, how everything is structured in the universities. But I've seen a video, I've been watching a video, that's called, it's Kelebogile's video. I will mention her in the comment section. They were basically venting about fourth year also, and what I noticed is how different like we do things. They were talking about stuff that we did back in like in the first 3 years of university, like naming nerves and stuff. But yeah, I have just mentioned what I know, and hopefully, yeah, that helps you guys. So now let's talk about accommodation. How like different, what are the different accommodation options that you have in medical schools? So you can either choose to use the university residents that are available, or you can have a private accommodation. We call them PAs. So basically, your resident accommodation, we have like different races for the different years. So for example, in first year they have their own residence, second years, third years, etc. Yeah, that's basically it. They're quite close to the university, but there's no what they call it, those races that are inside the campus, on campus residents. We don't have them in medical school. All of our races are outside of the school. You have to travel, and others are closer than others. Others are a walkable distance. Others are not. So the first year residents, I think they've changed from the one that we used to use. There's another race which is quite close. Okay, I don't know if I should mention the names. I don't know, for the safety of other students. I don't know, but it's quite close. And yeah, the second year resident is also close. There's like a bus that takes you to and from the rest, no matter how close it is. Then the third years have their own residence, but you might find yourself like living in a race mixed with second years and third years, but you never find yourself living with like the older people unless like there's like a serious crisis or something. Yeah, and they all sharing until fourth year. Fourth year, that's when you start having like your own room and stuff. That's where the fun begins. Fun. Okay, so oh yeah, in fifth year you'll move from Durban and you'll go to Pietermaritzburg. So there's also races there. I think you use the Pietermaritzburg campus, which is not for medicine, but I think they use that campus, but they use all hospitals from that side, and that's where I am going to next year. Okay, I haven't received my results for pediatrics, but hopefully hopefully that's where I'll be in January. Okay, so yeah, that's the end of like the accommodations and stuff. So now let's talk about fourth year. Let's reflect. Let's get into the nits and grits of fourth year. So I started with family medicine, as I've mentioned. Family medicine, okay, everybody says it's a chilled block, but because I did it as my first block, it wasn't so chilled. It was chilled when I now compared with the other blocks that I've done throughout the year, but I was struggling. It was like, I'm here, it's fourth year, I'm here for the first time, what do you mean? So what happened was that like we were waking up, going to the clinics, and when we got there, like, you know, our school is so unorganized, guys. We got there, the people don't know that we are coming, and then I could write a book about it, but it wasn't filled with the nicest people, but the people that were in my group, they were the best. We had the most fun in family medicine, and that's okay. That's all I can say about it. But okay, no, I should mention like how we were assessed for family medicine. So like, as I mentioned, I have 6 weeks. So in the last week we had, I think it was a Thursday, we had an OSCE with 10 stations. So the different stations would do different. Family medicine, like has so many different components to it. It's like mixed with peds and gynae and surgery. Excuse me. Like family medicine has a lot of things, and we had like 5 portfolios to write. So portfolio is basically like writing up on a patient, and on a patient that you've seen and examined. You write about the history that you took, the examinations that you did. Then I don't know if you had to write about investigations in family medicine, but yeah, like the whole workup of the patient and how you manage it and stuff. Yeah, so we had that OSCE, we had the assignments, we had, then on the last day we had like an MCQ, multiple choice questions, which were, I think there were 80 questions, which wasn't so bad. It wasn't that bad. We wrote the test, and yeah, and then I passed. And then the second block was trauma. Trauma is like more like your emergency medicine, like where you're saving a patient's now. You know, all those things with the shocking and everything. There was trauma was a lot. Trauma was a lot. I remember everything was divided into like weeks. So when we had 6 weeks, but then we had 1 week for the trauma part, and then for we had another week for orthopedics, we had another week for forensics, and we had like 2 weeks for anesthesia. So anesthesia is like, when a patient has like a surgery and you have to make the patient sleep and not feel anything, all those type of things. We had to learn about that for like 2 weeks, and we had to go to hospital for that. And I did make a video for my trauma, like I'll tag it, whatever they do, I will I will mention it here so that you watch it. You'll see everything that I was doing, and I did explain it. So yeah, that was trauma. The assessment for trauma, we only we only had one test for trauma. It was like you make it or you not, and that test is so difficult, guys. Everybody knows, everybody fears trauma for that test. So we basically had a test, and thank God I made it. We had that one assignment, and we did have like skills things to be signed off and stuff, but the main assessment was that test. And then for internal medicine, if I tell you, internal medicine was long. So it's supposed to be 12 weeks, right? But then in between, we had like our June holidays, so we had like 7 weeks in between. The June holidays also had like our selectives assignments. Our selective assignments are like, it's a research-based type of thing that you do. There were like 10 of them. We started those in second year, then we continued in third year, and fourth year was like our last one. So we had to do that selectives, all those 10 assignments. Some were individual work, some were teamwork. So it was just a lot, plus the internal medicine. So like, but I feel like we had more time than other people, because other people just have 12 weeks straight. I do not know how I would survive with only 12 weeks for internal medicine, but like we built differently, guys. Then for assessments for internal medicine, we had to have like, there were no portfolios, I remember that. We had to have what you call this, it's not an OSCE, it's like a real clinical exam. I think that was like the first clinical exam I had this year. It was like quite frightening, guys. We had like 3 patients. You have to have 3 patients. You get different things. You have to take a brief history, examine the patient, and then talk to the doctor about your management, your investigations, and like that's when you're excelling now. But that's the basic things that you had to do for this. You had three guys, not even one, 3. So for my first case, I got like a respiratory case, like a bronchiectasis. I got, for the second case, I got like a cardiovascular case. It was atrial fibrillation, I think. But I did bad at that station. But that lady was so old, guys. I couldn't feel anything. But yeah, then the third one was a stroke. And shout out to the doctors at that hospital. They were very nice, guys. And yeah, everything went well. Then we had like a theory theory paper on. We did the clinical exam on Wednesday. Then we did the clinical exam on Monday. Then we had the theory paper on Wednesday. No, I'm lying, right? We started with the theory paper. Sorry, guys. We started with the theory paper and then the clinical exam. The theory paper was like a written thing. I had to write. I think that was like the first time in my whole entire medical school career that I had to write something down. It was like all MCQs besides the assignments again stuff. So like that was like, but anyway, the test wasn't that bad. Yeah, but it was frightening. So yeah, that was internal medicine. Then we did gynae. I don't even know where to start, guys. Yo, gynae was the worst. If I tell you gynae was my worst block, like that's an understatement. We had like this mean doctor, guys. That lady was mean. That lady is mean. Like a mean person who's even mean. Okay, no, I mustn't say that. She might lose her job. But the lady is so mean, right, guys? When I tell you that lady made our lives hell, like, I don't even know how to explain it. I do not wish for her to get any, like, for anyone. I just don't wish. I don't wish her on my worst enemy, guys. She's the worst. Like, I don't know. I don't even know how to explain it, but I survived gynae. Lapo, we were the only ones who got her. She was like doing another rotation, and then she came to our rotation, and then she left. We were the only ones that got her this year. But I'm glad we survived. So for gynae, people were saying gynae was like the easiest and stuff. I didn't see anything that was easy. Even internal medicine was better, and internal medicine is said to be the worst. But you see, gynae, I can't even explain it. It has a lot of assignments. It had like a lot of assessments. I was like, this is just a 6-week block. What do you mean? We had to do like 2 portfolios. We had an in-block assessment. It was the first time I ever had an in-block assessment. So I was just surviving in gynae, I tell you. We had an in-block assessment, and that in-block's not even one, like there were 2, because we had like a clinical one, and then we had like a written one, but you had time to write, and then you went to present like to a doctor. And guess who I got for that presentation? Guess who I got? My heart was like beating out of my chest. I even forgot to say the most important thing that I had to say, because that woman was there. But it's fine. I really thought I was not gonna make it for that one. But we had that in-block assessment, and then we had, like, just imagine all of these things just for a 6-week block. And then when was this? On Wednesday of the last like assessments with the 6th week, we had to do an OSCE type of thing. Like, there's a doctor there, and they read like the scenario, and then you answer the questions. Mind you, the questions are not just 3 marks. They are like, another one's like 25 marks, another one is 15 marks, and I'm asking myself like, hey guys, there were 3 of them. I remember the first one was the infertility case. That man was nice. And then that sounded so wrong. That doctor was nice. And then we had like another one, which was like a pelvic inflammatory disease case. That lady was mean. If I tell you the ladies in gynae are mean, that's like an understatement. And then, but the last lady that I got for, what was that? It was like, what is it called? Pre-operation stuff that you need to do before like a patient goes for surgery. Okay, that case was nice. I know other people got like a mean doctor for it, but my doctor was nice. And yeah, and then you had a theory paper, which was like 80 MCQ questions. And guys, they were asking like percentages and stuff. Like, why are you asking me percentages? And for that paper, I was like, I was just circling, because it was an MCQ, so I was just circling and just hoping for the best, but yeah, it went well also. And then my last block was pediatrics. Okay, pediatrics was said to be hard also, but like I feel like it was more chilled than gynae, because we got a mean doctor, and the doctor in my pediatric rotation were very nice. They were just, it was okay. It wasn't nice. You know, when you get like a person who's super mean, and then when you get people that are mean, that's like better. Don't mind that. That's life in medical school. You always get mean people, you get nice people, and you might find that the person that was mean to you is nice to another person. It's fine. Don't take it personal. So yeah, that's yeah. Pediatrics, we had an in-block assessment, so now I'm used to the in-block things. But guys, when I tell you clinical exams, like, there's a feeling at the content when you have a clinical exam. So we had that in-block assessment, and then we had a clinical exam. Like, I got like a tiny baby, and I was supposed to like touch their chest. That baby was so tiny, but yeah, it was like a Down syndrome case. But I didn't know. I didn't get that until like until after I did the cardiovascular exam, because the doctor said just do a cardiovascular exam. And then afterwards I was doing the dysmorphology features things, and then I saw the flat nasal bridge and the fold and the ears and the semen crease. I was like, oh man, this is a Down syndrome case. And then I got like questions in this one case. And then we had the following day we had an OSCE. Yeah, an OSCE, and then we had to write something, and then we had an MCQ. Imagine so many tests, guys. And pediatrics was like, it was like this similar to internal medicine, but filled with other pediatric stuff. And guys, when I tell you children are complicated, like, we have to know what's the normal heart rate for this age and that age and that age, you know. It was quite a lot, and you had to learn the MCI guidelines. Guys, pediatrics should have gotten like 12 weeks, but here we are. Right now, I'm waiting for my results. I think I'll only post I'd only post this video once I get my results, because yeah. But next year I'm going to do 5th year, and I'm going to be living here in Pietermaritzburg, and hopefully everything goes well. And from wherever you're watching this video, if you're still in high school, if you're going to medical school next year, if you're accepted, good luck, guys, and hopefully you make it here. In as much as we complain about everything that is happening in medical school, we're still grateful for being here. So do not take our negativity in a negative way. So yeah, thank you, guys. Also, let me know if you still want me to post that internal medicine video that I did, but it was like a day when I was on call. It wasn't like on call, I had intake. So that's when, like, we normally in the hospital we knock off at like 4, but then if you have intake, you knock off at like 10. So that was what was happening there, and it was just basically taking you through my day. And if you want me to post it, please mention it in the comments below. Thank you. Don't forget to like, share, and subscribe to my channel. I love you guys so much. Until next time, bye.